Recently, a lot of patients have come and asked us, Doc, does your technique of gynecomastia really work? They have seen some videos and spoken to some doctors who say that it does not. Let me assure you, I have been doing this since 2020 and so have many other doctors. And this is a legitimate technique where we do gynecomastia. How it differs from the other techniques is that we don't give you a cut in the front of your chest and remove the gland of the gynecomastia from the side of the chest itself. In this video, we'll talk about the evolution of this technique, why we do it, what are its real advantages, and yes, how it works. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon practicing in Borivali West. I'm the head of plastic surgery at Skinzone Aesthetics in Mumbai. So why do we remove the gland from the side of the chest? What are the advantages of it? Let's talk about this one by one. First and foremost, the main advantage that you as a patient can very easily understand. We do not give a cut on the front of your chest. So there is no chances that if the scar sort of does not heal well, that these will be visible. If the scar is not visible, there are no telltale signs that a surgery has been done, which is, according to us, very, very important after an aesthetic procedure. Boys and young men want to remove their shirts after the surgery, and that is why they are getting the gynecomastia surgery done in the first place. So if we let these scars stay and they become visible, they are as or perhaps even more sometimes mentally debilitating and sucking out the confidence from patients than the gynecomastia itself. So we do not want any chances of this scar staying. There are some other technical improvements as well that this surgery brings to the consideration. The chances of there being defects under your nipple are much lesser with this surgery, because we can always see what the post-surgery result will look like. We don't have to cut into your tissues, so the pain and all of that healing process is also much better. These are the main advantages of this surgery, and as I said, scar being the main one. So this surgery was basically started way back in 1998 by a doctor called Marcelli. It has a long evolution. A lot of people have sort of improved it by using ultrasound assisted liposuction, power assisted liposuction. There are senior doctors doing this all over the world, the US, Canada, UK. In India, there are a few doctors, few of us doing it in Delhi, in Gurgaon, of course me doing it here in Mumbai. Now, if a lot of doctors are doing it, it's only because it's working and it's giving good results. It does require some special training, and it does require a little bit of more understanding about the condition, and it has a learning curve to it. Of course, it's not something that is technically very different from what we do during liposuction, and so we assure you that the results are definitely there. This technique was basically evolved, as I said, to avoid the scars or the telltale signs of the surgery. And this is something that if you see a before afters, you will definitely appreciate that there are no marks on the front of the chest that are visible if the scar becomes bad. 90-95% of the patients in whom these scars are given on the front of the chest between the areola and the normal skin, which is the dark and the normal part of your skin, are not visible. But sometimes they can become thicker, they can become lighter or whiter in color, or they can become darker in color. In these conditions, it's very difficult to correct these scars. And so this technique has evolved, and we in our practice have adopted it. So if you guys have any more queries regarding this technique of gynecomastia, anything in plastic surgery, do let us know and we'll be happy to help you. If you have any other queries, drop them down in the comments section below, or you can give us a call or drop in by to us. Thank you.